Please help me welcome Mike Broomfield and Sean Egan from zizzl Health. Zizzl. Come on. Oh, you're not coming.
I'm going to grab a clicker here. Morning, everybody. My name is Mike Broomfield. I am from zizzl Health. First, I want to say thank you to the NHP team, the New Health Partners team, and Sean and the Oscar team as well for being a part of this presentation, for giving me the stage today and allowing us to speak about the individual coverage HRA and how everyone out in the crowd can hopefully start using it once you learn about it. So as I said, my name is Mike Broomfield. I'm the Director of Strategy for zizzl Health. What we are is an end-to-end ICHRA company distributed exclusively through agents and brokers. So today I'm going to talk to you about a few things, just set the stage and then hopefully set you off selling ICHRA when you leave this room. First, I'm going to talk a little bit about zizzl, who we are, what we do, and what our role is in the healthcare ecosystem. Then I'm going to talk a little bit about ICHRA, what it is. We call it the healthcare 401k and how you can start using it. We'll go through the myths and facts, and this is when I'll pull in Sean Egan from Oscar to talk about some carrier considerations and some of the things out there that may or may not be true about the individual coverage health reimbursement arrangement. We'll see what the stats say now that this is a new type of insurance that's been here for a few years, and we have a few stats on how the consumer and employer experience is going. And then we'll get into how it works with the ACA and how you can go out and sell this new individual coverage HRA with the tools, certification, training, knowledge, and expertise that you already have today. So first, a little bit about zizzl. We were initially founded in 2016 as a payroll and benefits company, so not an ICHRA company. The ICHRA that I'm talking about here today did not even exist in 2016. We were initially a company that looked to combine the benefits agency side of things with the payroll side of things for businesses, make life very efficient. Then we saw the executive order that made ICHRA available in 2020, and we shifted our entire business model. So today, ICHRA is an end-to-end ICHRA technology platform distributed exclusively through brokers. We have clients across the country ranging in size from 2 employee lives to 1,000+ employee lives, and these are all group-based health insurance clients. A very important point about zizzl Health is that we are sold and distributed exclusively through health agents and brokers. We do not compete with you in the market. We do not have a B2C model. We are partners with brokers on every single case that we write. There's always an agent in the mix. Before I dive into the ICHRA and tell you what this acronym that I've repeated probably 5-10 times by now actually means and get into the details, I want to talk about the things that are important at zizzl and why we're going to be a key partner for you beyond just the software and services that we provide. And that's campfire culture. This industry can be tough, especially this time of year as we all head towards the OEP period and have members renewing. In the ICHRA space, it's no different. Life gets a little bit hectic. It's important to us to have these values to bring all of our members, our partners, whether they're agent partners, technology partners, downstream clients, or anybody in our ecosystem, back to the campfire. And that means we're going to be dependable, we're going to be authentic, and we're going to be optimistic, even when it's really challenging. There we go. So ICHRA, I think I've probably clocked it 10 times by now. What does it mean? ICHRA stands for Individual Coverage Health Reimbursement Arrangement. It's a new type of HRA that allows employers to replace their group health plan with coverage based on the ACA. So this is an HRA that allows employees, rather than getting that one-size-fits-all plan from their employer, to take a bucket of money and purchase exchange or off-exchange ACA coverage direct from an insurance company. I want to go back one. I apologize, my slides are just a bit delayed here, so there we go. So I wanted to be on this slide. So the ICHRA itself is a fairly simple concept, and it's relatively new. As I said, this is a type of health plan that's been available since 2020 via executive order. So it's very new. In the past, you couldn't just load up an HRA for your employees with funds and have them go buy exchange insurance. With this new ICHRA, you can do exactly that. So an employer is able to get on a pre-tax basis for both themselves and their employees a group-funded health insurance model built around ACA plans. This is very impactful, it's very powerful, and it gets employers budget stability and a defined contribution model that they may not have access to in the traditional group space. Now, we think of the traditional group health insurance model much like a pension plan. It's a great retirement option. An employer decides how the money is invested, they build the plan for employees, and they get that one-size-fits-all investment vehicle for their retirement. We think of the transition from traditional group plans to the ICHRA much like the transition of those pension plans to 401ks. The ICHRA is the 401k for health insurance. You're essentially keeping the retirement benefit in place, but no longer picking that one-size-fits-all plan for your employees. You're letting them decide how their investment vehicle is driven and letting them pick something that works for themselves because there is no one-size-fits-all health insurance plan. Everybody in this room knows that. That's why we have so many vast options in the ACA market as compared to traditional group, and the ICHRA takes advantage of that model while getting employers out of the mix of this parental health insurance model that we're all so used to. I'm just going to give my slides a second to change over so I don't go too far. So there's a lot in my presentation that I think is very, very important to take away today, but I think the few things that I'd like everybody in this room to digest and walk away with are, first of all, group health insurance now can be built without the group plan via this ICHRA. Employees are using this ICHRA from their employer as their group plan to buy ACA coverage. As a result, we can all see the writing on the wall. Businesses now, for the first time, need ACA agents to help them with their group health plan. Traditional health agents are not necessarily equipped, not appointed, not knowledgeable, and don't know the space. But these are businesses that need ACA agents to come in and deliver both the consulting experience and the partnership that you need in the ACA space built around a group plan that's going to be delivered to all of their employees. What are the benefits of an ICHRA? Now I'll go through these and I'll try not to bore anybody line by line, but there are quite a few benefits for an ICHRA. First, it's budget friendly. As you can imagine, this is a defined contribution model. Employers get to decide how much goes into this HRA, how much they're going to spend on health insurance, and they're dealing with the average premium increases in the ACA market. So their company's relative level of health or utilization does no longer matters for their rates or their ability to get coverage. Renewals are hassle-free. Again, my utilization, my population, my company's general level of healthcare need no longer impacts my annual renewal or the plans and options and pricing that's going to be available to me because it's all driven on the ACA. Employees are happy. As we know, there is no one-size-fits-all plan for health insurance. You've got folks at every organization who want the low-deductible premium plan with their prescription and their doctor and network. And you've got folks who don't know what primary care physician is, haven't been to the doctor in years, and they just want that minimum level of coverage from their company. So to get away from that idea of a one-size-fits-all plan, we offer employees an ICHRA, which allows them to all take that bucket of money and decide how the dollars should work for them. If they want a platinum plan, excellent. If they want a catastrophic plan and qualify for it, fantastic. The employer no longer has to choose the relative level of insurance that every employee gets. They put the budget together, employees take the money and run, everybody's happy. Another hallmark of this model is the quality and quantity of insurance companies and plans. And this is something that I don't necessarily have to say to this room at all. You all work in the ACA space. You know exactly what's available on the marketplace and how competitive it is from a benefit offering perspective. We've got extremely great arrays of plan designs, of carriers available, from the BUCAs that the people on the traditional group world will probably know, to your regional and ACA-specific carriers like Oscar, like Ambetter, that make an excellent member experience and come in and compete with this ICHRA and give employers many more options when it comes to their group health plan. There's no underwriting in this market. As you know how the ACA individual plans are underwritten, how the rates work, your relative level of health or sickness in a given year is not going to change your premium rates. This is not how it works for many traditional group health plans, and this makes it a challenge for companies who have even one or two sick individuals driving their premium rates up year over year. They may want to offer an excellent health insurance offering, but it's becoming too expensive. I think the next two hallmarks of this plan and why the ICHRA didn't exist until 2020 is because it couldn't stack up to a traditional group health plan. You couldn't just give your employees a stipend to go buy ACA coverage and have it be pre-tax. With an ICHRA, you can do that now. You couldn't just give your employees a stipend to go buy ACA coverage and have it be ACA compliant if you're an employer that has to offer group health coverage. With an ICHRA, you now check that box. So in terms of the traditional group health plan offerings, there's really been nothing built around ACA products that's been able to stack up with those available in the traditional group space. And ICHRA is the first time that's been the case. So I just want everyone in this room to be extremely excited about the ability to come in and compete with traditional group brokers, the ability to win business, and the ability to write 10, 15, 20, 200 ACA clients just like that because a company is bringing them right to your door. Who are the companies out there that are attracted to ICHRA? And there are quite a few. This is not a magic bullet. It's not a one-size-fits-all plan for everybody. There are many organizations where this won't be less expensive or this won't be stronger benefits. But for those that there are, we find the ICHRA is a very, very successful solution to implement. First, it's your organizations with multiple years of health insurance increases. We all have those business owners, whether they're our friends, our golfing buddies, they're in our book today, but they just can't deal with another 20% increase. Whether the company has 50 employees or 500, 20% added to my costs every single year is untenable, and I want something more stable. And ICHRA allows you to do that. Again, there's no claims experience, no underwriting with these ACA plans. You're deciding what goes into your bucket for the next year. Number two, high turnover groups or low participation groups. Think hotels, restaurants, folks in hospitality. These are companies that, for both compliance reasons and for competitiveness reasons, have to offer a strong group health benefit. It's very challenging for them to do so and to get a competitive quote if they have 20% participation or if their population changes year over year, week over week even. It can be very, very tough for these groups to get a fair shake in the traditional group space. With an ICHRA, those demographics we're talking about, high turnover, low participation, the types of employees that work there, they don't matter. They won't impact your premiums. The rates are what the rates are in the ACA market. Number three, that's a big bucket. This is the ownership or the business owners who are aligned philosophically with moving from the pension plan healthcare model to the 401k healthcare model. So the business owners who don't want to have the parental control over health insurance anymore, they're going to give you a bucket of money that they know provides great benefits, but they're going to allow you to choose what health plan you get and how you spend those dollars. Many, many business owners, whether ICHRA is less expensive, whether it has the same insurance company they had in place today, are switching to an ICHRA because it gets them out of the mix. Employees get to make their own choices, the employer's funding it, and everybody's happy. Number four is a less common case, but it is also an area where ICHRA is very powerful. Organizations like our own at zizzl Health, we have employees spread across the country. Perhaps there are people out on the West Coast who need Kaiser. Perhaps there are people like me who live in Milwaukee where Kaiser isn't even a thing from an insurance or hospital system perspective. Finding that one-size-fits-all plan option for everybody can be very challenging. With an ICHRA, again, you're funding an HRA where everybody's going to go buy the local coverage from the local carriers that cover their doctors, their hospitals, and I, as a business owner, no longer have to worry about picking some sort of one-size-fits-all option that's going to make everybody happy. Then finally, our last bucket is what we call our compliers. Those are businesses that have to, from ACA mandates, offer both essential and affordable health insurance coverage to their employees. In most states, this is companies with 50-plus full-time equivalents. They may not have a big budget for health insurance. They may not have experience or even a plan. But once this mandate goes into place, they have a legal requirement to offer benefits to their employees. Many companies will go the route of a MEC plan or a minimum essential plan. But with an ICHRA, you're not taking away the ability for your employees to get really strong benefits. With a MEC plan, you're putting something relatively minimal in front of their face. With an ICHRA, even if your budget is minimal, they have the ability to buy up. You're still giving them the platinum plans and the gold plans in their market. You're still giving them the ability to get really strong insurance coverage. You're checking your legal boxes, and you're not blowing up your budget. So there are a lot of myths out there. This is something else that I don't think I need to go into too much depth with this audience because you know the ACA market is rife with myths, whether it's traditional group brokers trying to throw a little bit of shade on the ACA market and make it more challenging for us to break into the group side, or it's just misconceptions from when the ACA first came out and there were various media campaigns designed to throw shade on the ACA. So ICHRA is no different, and a lot of those myths come out of the ACA myths. First myth, that ICHRA doesn't count as group health insurance. It's some alternate option for your company to ditch their group plan. And that's not true. An ICHRA is a group health insurance plan. It can check all the same compliance boxes built through a Section 125, and you are not, you're not removing or adding an ICHRA onto your group health plan. You're able to replace your group health plan with an ICHRA, check all the same compliance boxes, and have all the same quality of benefits for your employees. Another big myth that comes out of the ACA, the plan designs and insurance companies aren't competitive. Everybody in this room knows that's not true, and whenever our sales team hears that, we say just get a quote. Our quote will show you the pricing, it'll show you the insurance companies available, you can look at their provider networks, you can look right in the plan designs, and you'll pretty quickly see that there's something in almost every market that's probably stronger than what you have in terms of a group benefit today. It may not have the broad network that your PPO has, but at the end of the day, I don't need 800 doctors in network. I need my doctor, maybe my kids' doctors in network, and with an ICHRA, you have no problem making that happen. Another big myth out there, ICHRA's only for microgroups. It's absolutely true that your 2 to 10 life businesses love an ICHRA, your dentist's offices, your small businesses, your hardware stores, and ICHRA works for them. It's simple, it's streamlined, and it's budget friendly. It's also true that large businesses are the biggest growing segment in ICHRA today. The majority of zizzl Health's clients from our ICHRA platform are actually applicable large employers with an average size of about 90 employees. So this is an ACA-based group health model where companies with 90 to 900 plus employees are loving it. They're engaged in it and they're writing ACA contracts through it. And I think the biggest myth out there is if you engage with an ICHRA, it may be great for everybody philosophically, but you're at the end of the day just throwing your employees out to the wolves and making them pick a plan on their own and figure out insurance. And that's not true, especially with a great partner like zizzl Health. And everybody in this room, there is always an agent involved in the sale with an ICHRA if you pick a good partner. Every employee on our platform has the ability to talk to a licensed agent as they shop for a plan. Every employee on our platform is going to have decision support tools that make it very, very simple for them to enroll and choose the right benefit. And every company on our platform has a dedicated account management team that walks them through this process to make it look and feel like a traditional group health plan, even though we're still talking about ACA policies being enrolled at the end of the day. So yes, could you set up an ICHRA via this HRA and just tell your employees to go buy exchange coverage? Absolutely. And at the end of the day, the exchange is a wonderful platform. It's easy to get connected with an agent, and it wouldn't be that bad of an experience to just send them off on their own. We still make sure that doesn't happen. We still make sure that every employee has a licensed agent that they can talk to that will write their plan and get 100% of the compensation for it. Give it 1 sec to switch slides here. So as you can imagine, ICHRA being a type of group health insurance, it does come with a few compliance considerations. There are many at play, and they pretty much align with what you'd see on the traditional group side. So as I said before, an ICHRA is not an alternate to group health insurance. It is an alternate type of group health insurance. It's the same considerations as at play. While the individual policies being enrolled in are considered fully insured plans, an ICHRA and the HRA group health plan itself is a self-insured plan for employers. ALE mandates remain the same. You still have to provide minimum essential and affordable coverage, and other reporting and compliance mandates are still there. So whether you have to provide COBRA notices, whether we're talking about filing 1094 or 1095 ACA reporting, the traditional group health requirements don't go away. The benefit of choosing a partner like zizzl Health is that we tie all of these things into our platform. So we're directly connected to the IRS. We will file our businesses' ACA reporting on their behalf. We have automated COBRA notices right in the system. So as an ACA agent, you don't have to learn all of the compliance considerations of the traditional group side. You don't have to have 200 more toolkits in your book just so you can figure out how to sell this and not do it improperly. zizzl is tying together all those traditional group health plan considerations to make selling ICHRA streamlined for both you and for your clients. So now I'm going to take a quick break and actually bring Sean Egan from ICHRA up to the stage to talk about the carrier perspective. Now, I have my thoughts on this side of things for sure, but I think a more valuable opinion and insight would come from Sean, who works directly at ICHRA. So, Sean, thank you very much.
Thanks, Mike. Those lights are bright. Good morning, everyone. My name is Sean Egan. I'm the Vice President of Sales at ICHRA Health. First, I want to thank Mike and our partners at zizzl. the opportunity to share a carrier's perspective on ICHRA. And then also want to thank our friends at the ACA Way, Tony, Megan, Gloria, for the opportunity to sit down with Mike at the conclusion of this presentation. Please. At the conclusion of the presentation for a little fireside chat. So I will do a quick plug in terms of if you have any questions, anything that Mike says, anything that I might say, please, we will be happy to discuss that at greater length afterwards. Okay, so carrier considerations. So there are three things that I'm hoping that I can leave you with today, if there's anything that I can say. The first thing is the growing ACA market. At Oscar Health, we're very excited about the growing ACA market, and we see ICHRA as a catalyst for continued growth, both in the near and long term. What's great is that the growing ACA market, for the folks in this room, you are all ACA experts. So it's a great opportunity to expand your business further. If you've heard anything from Oscar Health, out of our leadership, out of our press releases, out of our earnings calls, our CEO, Mark Bertolini, is very bullish on ICHRA, very excited about ICHRA. And the fact is, employers now more than ever are looking towards ICHRA or looking at options that are different than what they're used to on an annual renewal basis. Give me something else. Their employer brokers are looking for it, but they don't have the understanding of the individual market. So it really could be a great differentiator, both now and long term. The second thing that I want to mention is ACA market rate stabilization. So by contrast, in the employer space, the average increase in 2024 is about 9% on a medical trend for employers. That's about 26% higher than the individual increases from 2018 to 2024. So in terms of having a pricing that's stable, it allows employers what used to be a fluctuating expense year over year, they can now leverage that stabilization, set a budget, accurately forecast, so that them and their employees will not have to change their premiums or their contributions year over year, which I know is one of the biggest drivers, and I know Mike had touched upon that earlier. Also, what we've seen is that this, for first-time businesses, ICHRA is enabling them the first time to give employees benefits that they haven't had in the past. So yes, it's a great opportunity for those who are looking for new solutions. It's also a great opportunity for employers who want to give employees options, but they haven't had the ability to do so. ICHRA has been a great funding mechanism in order to get that done. So now that we've covered the increasing ACA market and the growing stabilization in the ACA space, the third thing that I want to emphasize is consumerism. Historically, the employer-sponsored plans have had this one-size-fits-all approach, right? I can have, if I'm a small or mid-sized business, I can have a single carrier, I have their network, and I might have one or two plan options, right? A high and a low. If I'm lucky, maybe I have 3 plan options, a low, medium, high. ICHRA completely changes the landscape for that, flips it on its head. And I think that that's really important. And the carriers in the commercial space that have been most prevalent in small and mid-market, they have broad national networks. And those are great, and Mike had said it before, but there's also an inherent cost in maintaining those networks year over year, when the fact of the matter is that consumers only need maybe a handful of providers for their families, in urgent care, in a local hospital. So the overinsurance, if I'm an employee of a mid-sized business, now I have 1 million hospitals in my network that I can have access to. That's great, but will I ever actually need it? Probably not. I can have every hospital across the country in my network, but again, will I ever need it? Probably not. So the increased consumerism is something that the employer space hasn't seen before, and the efficiency of the plans and the networks that ACA carriers deliver is really changing expectations on what employers and employees can come to expect from Group Health plans. Aside from networks, you'll also see carriers are coming out with more off-exchange plan designs. So that is for employers, it's going to meet the needs of employers in terms of what they're expecting, right? So if I'm an employer and I'm used to having a deductible at a certain level and a max out of pocket at a certain level, and my co-pays and co-insurance at a certain level, Those are all factors that can be met. Maybe I have an HSA plan or two. Also, the ACA plans can also be introduced now to the employer space, whether those are chronic condition-specific plans, whether those are Spanish-speaking first plans. The type of consumerism that hasn't been available in the employer space is now available through ICHRA. The only way that an employer in the country can get access to Oscar Health, for example, is through ICHRA. And I will use Oscar as an example for consumerism. So our latest NPS score, NPS is a metric used, will a member, are they satisfied and will they recommend us to their friends and family? Oscar's NPS score is a 68 as of June of 2024. By contrast, I'm going to use Apple, something out of the insurance industry, as a comparative. Apple's in 2023 was 61, and in 2024 it was really unclear. It's either 63 or 71. It's in that vicinity, very high. And I think that is a real testament to consumerism in terms of people being satisfied with the health and well-being that their insurance carrier has given them and that they haven't had the option to get in the past. I also, if you go to the next step, you can go to Google AI, hey, why does Apple have a really high NPS? And I just wanted to quote these three things: innovation, strong brand loyalty, and a sense of community. I think those are tightly aligned with Oscar's mission in terms of what Oscar Health wants to do for our members, for our brokers, and for the communities that we serve. So to recap, the three things that I'm hoping that I could leave you with here is 1, the growing ACA market, 2, the market risk stabilization as the market continues to grow and ACA rates are at a competitive advantage, not everywhere, but in a lot of places to employer rates, and then 3, consumerism. When people are the center of the product that they are purchasing, the satisfaction goes up along with that. So I'm going to bring Mike up here now. But the fun now passes to the folks in this room after Mike's done, right? It's distilling the information. It's finding employers or clients that are looking for new solutions. And it's the folks in this room that are really going to be able to deliver the next wave of growth for ICHRA. So thank you all for your time.
Thank you, Sean. That was excellent. As I said, I think getting the carrier perspective directly from a carrier partner like Oscar, who's been instrumental in zizzl's growth in the ICHRA space, is more valuable. Obviously, I am an ICHRA evangelist. I believe in it. I live and breathe it every day. But to have our carrier partners like Oscar leaning into the market, making life easier for us, figuring out how to design the plans, the processes, the broker engagement, the sales side, all so that it makes ICHRA easier, has been an incredible value add to us. So now I want to go a little bit into the stats, and I'm not going to get into a million stats, just a few that I've highlighted that I think are very important and lend themselves to ICHRA's growth. First, and this one is extraordinarily important, this is from a Deft Research study this summer, and it's not directly related to ICHRA, but it looked at employer groups where employees moved from a traditional group plan to ACA coverage, whether that was ICHRA-based or otherwise, and measured their satisfaction. 93% of individuals who moved from a traditional group plan to an ACA plan were either just as happy or happier with that ACA plan. And actually, half of those 93% were happier. So about a half of individuals who switched from traditional group health plan to an ACA plan were happier, and the majority of the rest of the group was at least as satisfied. So again, myths aside, everything that's out there, folks like ACA coverage. They like the experience, they like the carriers, they like the simplicity, and they like the help that they get from an agent that they're not necessarily getting in a traditional group health plan, because who's going to help you pick between one or two options? So again, I think that's very powerful in terms of the satisfaction. That's going to be one of the big myths that you're up against out there. Well, the next piece is that should get everyone excited. This is a blue ocean. This is not a saturated industry. ACA, Medicare, Medicaid are excellent sales funnels. They're also very saturated. You know you're out there brushing elbows with competitors every single day. That's not the case with an ICHRA. This is somewhere where you can carve out your niche using your skills as an ACA agent today, and it's an extraordinarily fast-paced growing industry. We saw almost 30% compound growth last year in 2024 in the space as a whole, not just us at zizzl Health. And the large employer space, and those companies with 50-plus employees on their payroll, they're growing even faster. They grew at almost 85% growth rate last year. Businesses are leaning into ICHRA. They're leaving traditional group health coverage for this ACA-based model, which brings a whole pool of new prospects out there for ACA agents who are willing to lean in, learn ICHRA, and dive into this market. A few considerations for the marketplace in ICHRA. As you can imagine, it's not going to work one-to-one with your expectations on traditional ACA coverage. The first thing being something that Sean already mentioned, on versus off exchange plans. Both on and off exchange plans are ICHRA eligible or ICHRA compatible. An employee given an ICHRA can enroll in an off exchange plan, they can enroll in an on exchange plan, but there is an advantage to them enrolling off exchange. It is important that ICHRA agents lean in, learn from their carrier partners if there are differences in off-exchange product shelf and off-exchange process, and figure out how they can build their off-exchange repertoire. And ICHRA does depend on these products. Without getting too deep into the details, essentially there's a tax benefit for the member to choose an off-exchange plan versus an on-exchange plan. If they have anything that they pay towards the plan premium beyond what their employer is funding, they do want to get that pre-tax, like a traditional group health plan. They can only do that if they buy off-exchange. So it's important as an ACA agent selling ICHRA to understand the nuance there, and you'll have a team at zizzl Health as your ICHRA partners, along with the new health partner team here in Florida, to make that process easy, to make the transition to off-exchange simple, and make sure you're ready to go. Another consideration is ICHRA and the premium tax credit. You might be thinking initially, wow, if I qualify for the premium tax credit, I also get this bucket of money from my employer, I'm gonna have every single plan available for free. Unfortunately, if your employer offers you an affordable ICHRA contribution amount, you won't qualify for that premium tax credit from the exchange. So an employee will have to take their ICHRA dollars and use that to purchase coverage rather than qualifying for a tax credit. Now, if their employer doesn't offer affordable coverage to the family members on the plan, those family members may still be eligible for a tax credit, and this just lends itself to the complexity of the ACA market that traditional group brokers are not ready to handle. They're not ready to consult member by member at a business through who should be taking a tax credit, who should be taking their HRA, who needs the catastrophic plan, and what that even means. So just some of the considerations as we walk through how an ICHRA and the ACA work together make it very obvious that ACA agents are required for a successful ICHRA model. I won't bore you with the eye test here. It is actually a pretty large, impressive LED screen that I wasn't expecting. So everyone probably can read this, but I'm not going to go through every item. The idea here is that zizzl Health is a full end-to-end platform for ICHRA. It's not just a shopping and enrollment platform where you'll help employees pick a plan. It also has the entire suite of sales resources and tools you'll need, from quoting to compliance to actual marketing materials. It also has all of the compliance and administrative needs that an employer will need. So whether they're a large employer and they need real-time reporting, ACA connectivity, and COBRA, or you're a small employer and you just want to give each employee a bucket of money to shop for a plan, zizzl Health has the robust solution that's going to make ICHRA as simple or even simpler than a traditional group health plan system. We also have a few things that help us stand out from the rest of the industry. We are a secure platform. We have a SOC audit. We have the full site and our resources available in both English and Spanish, and we have on-platform Medicare integration as well. So again, everything that an employer group is going to need to help their employees find coverage through the ACA way and find it in a way that's probably a lot more satisfactory than their traditional group health plan. You'll see over on the right-hand side here, we also have some buy-up services. So for groups that need the additional reporting and functionality, we tie that all in for you. So again, what I want you to take from this is as an ACA agent, to sell ICHRA, you don't need to tie in 50 or 60 different pieces to make the entire game work. You just need to bring in zizzl Health. An extremely important hallmark of our platform, as I mentioned at the start of the hour, is that we are distributed exclusively through brokers. We're not out there competing with you in the market. We have a couple of different engagement models, one tailored towards the traditional group health broker and one tailored towards the ACA broker. The models are very similar. Neither broker pays for access to zizzl Health. There's no fees to be a partner with us. Both brokers get trained up, but the ACA broker has more responsibility and vastly more compensation with zizzl Health. So I think that's something that's very important to understand, is that the ACA broker is fit and designed to be a zizzl Health broker. We also have a dedicated support team. So while employees who call into our platform always get an agent to talk to, they always get tech support when they need it, you can also rest assured that you'll have a zizzl Health sales rep in lockstep with you through your entire sales processes. So we're not leaving you out to the wolves the same way that you won't leave employees out to the wolves when they need to enroll in coverage. You'll have a Zizzler on your team that'll feel like they're on your team, helping you through the sales process, making it simple to consult with the business. Everything from the demo of the platform to the end contract will be designed and piloted by Zizzl. And finally, we have smart technology. We have an excellent enrollment platform that will be simple and seamless for all of you to learn and help employees navigate. It's very similar to what you've seen out there today in terms of the ACA side, but it's built for ICHRA. So it has everything. Folks will be able to check their providers, their prescriptions, put in custom budgets, their healthcare needs, and you'll, as a broker, have access to the platform to tap into every employee's profile, help them pick a plan and manage their coverage. Now, this is just a brief screenshot of our shopping experience. I'm not going to go into a demo or anything crazy like that today, but the idea is that it has all the tools that an employee will need to shop for a plan. You've all seen AutoTrader or Amazon or healthcare.gov, and you know what those shopping platforms look like. You know the filters and the tools that individuals need to sort down a list of 100 plus down to their exact right choice and the one that works for them. So Zizzl Health is no different. We're going to provide you all the filters, all the tools to seamlessly integrate every single thing you need, whether you have a list of 12 doctors or you just have an end budget amount that an employee is looking at. Everyone gets a custom experience, and every ACA plan that's ICHRA eligible will be loaded on the platform for enrollment. Now, how do we get you jump-started? We are not going to let you reinvent the wheel, and we are going to make sure that you have a head start over those traditional group brokers and over every other ACA broker who hasn't jumped into ICHRA yet. So when you sign up with Zizzl Health, we're going to load you up with a broker toolkit, with an account manager, and with training to make sure you know the ins and outs of selling, and you know what your responsibilities are and where Zizzl Health takes over. So we have cold calling scripts, we have email templates, we have PowerPoints, we have webinars, we have pre-recorded videos, we have cheat sheets in English and Spanish. Everything you're going to need to sell this without starting from ground up. Our sales discovery process is very simple. What I want you to understand about this is that it's a few steps, and there's going to be a Zizzler with you every step of the way. So we're going to help lead that discovery meeting with you and the business. We're going to help you get a quote and make sure that you understand the data, and we're going to create the financial projections and help you walk them through with that group. We'll be providing a system demo to you, and we'll be providing pre-templated, ready-to-go contracts for you to sign your group up once they've decided to go with an ICHRA. It's a very, very simple process. Again, we understand your strengths in the marketplace. We're not trying to get you to build up an entire new toolkit of skills. We want you to understand that with an ICHRA with Zizzl Health, we're going to drive all the processes that you're not used to or accustomed to, and then you're going to come in with ACA expertise and make sure that members have an excellent enrollment experience. Well, this is a spot where I'll stop, and I think if folks want to take a picture of it, I'll also have this available. I'm sure we can pass this out as well. But this is our management map for the sales side. So this is not all Zizzlers across the country, but this is where we have regional sales managers strategically located to work with brokers. So today here in the building, we have Brett Hollenbeck down on the right-hand side there. He'll be running the Zizzl booth downstairs. Please go say hey to Brett. He's a great guy to know. He's an excellent ICHRA resource, and he can help you get started with your selling process today. So if you're interested in selling this ACA-based group health coverage, or you just have questions, you want to get our ear, we'd be happy to talk to you today. We'd be happy to have you connect with a different regional sales manager if there's one located in your region that would make more sense. Or if you have questions because you've got agents everywhere, you have clients across the country, just come say hey to me and Brett. We always love talking ICHRA. The last thing that I'd like to leave everyone with before we go off towards the question portion is our two models and why the ICHRA, and specifically Zizzl Health, is tailor-made for an ACA agent to succeed. We have a couple of models, as I said. We have a premier model and a referral model. Our referral model is what we typically would look at with a traditional group broker, and our premier model is what we would typically look at with an ACA broker. The important things to understand here is who maintains BOR status, who's the broker. In the premier side, it's you. Who services members and helps them shop for a plan? That would be you. Who receives 100% of the commissions? That would be you. And then who has a variable payment methodology where you can bake in other consulting services based on the additional benefits that you sell through our platform? That's you. So again, zizzl Health is not impacting your ACA commissions. We're not impacting your enrollment process. All we're doing is giving you the tools to sell ACA at scale to businesses. So thank you all very much for listening to the presentation portion of today's session. I'm going to bring Sean back up, and then we're going to jump into some Q&A sitting at the chairs here.
Yes, so we're going to have you guys move the chairs here to the center. As you can see, there's a QR code. Are we done with these QR codes? Like you have to go QR code everywhere. In the corner, use it. Send your question because it goes into their iPad and they can answer the questions directly.
Perfect.
So we love technology up to the point when we have to get used to the technology. But use the QR code, send in your questions, and then Sean receives the question right there on his iPad and they can start answering questions.
Great. Okay.
Maybe we can focus the camera to the QR code so the people that can't reach it in the center can see it on the camera.
And I can get us started here. So Mike, thank you. Love to ask, you had referenced it a little bit, but can you get into greater detail about what size group or industry is best for ICHRA?
Yeah, this is a question we get a lot, especially from our traditional group brokers, frankly, is what type of business is this the right model for? Is it for trucking companies? Is it for schools? It's not a one-size-fits-all. It really is based on those 5 kind of use cases that I talked about. And ICHRA may be an excellent fit for your transportation company, for your hotel, for your school. It may also not. It's something that does require groups do a competitive analysis, and that's something that zizzl can really easily provide. So at the end of the day, the ICHRA can be a fit for almost any market. It's going to be a fit for any employer who wants a simplified model where employees have more choice and the employer has a little bit more budget control. Now, of course, industries with low participation, industries with high turnover or a little bit higher risk are going to be a more natural fit for ICHRA.
I will say, just to add on to that too, from a carrier lens, the business for Oscar and for the carriers can be situs anywhere, right? So this is a option across all 50 states. If the employee base from Oscar's perspective is in one of those 18, one of our 18 states, then we can, in theory, a group who's not in our service area, some of their employees can actually get access to Oscar. So that's the optionality and the consumerism. Just to pile on
I
there.
mean, that's a great point. And just to build on that a little bit too, as an ACA agent to sell ICHRA, you do not need to be appointed and licensed in every state with every carrier across the country. You need to have your area locked down. You need to know the carriers that you want to write, the business that you're going to be submitting, and zizzl Health will build our network around yours. So we are also licensed and appointed by the carriers, but we prefer to have our agents write the business and make the money with our model. If there's a carrier you don't write, or you have a business that comes in and they've got an employee out in Alaska or California or somewhere else that you're just not even licensed, we'll have our agent team write it. We'll still make sure you're compensated through the model. And it really works for ACA agents. They don't have to build up a network of every carrier, but they can write and use the carriers that they're already using today.
So doing this live on the iPad is very fun. So one question in terms of timing, right? So we are in September, open enrollment's around the corner, AEP, 1/1 busy selling season. How long is the training and how soon can an agent be ready to sell?
So an agent should work with our team today. If you're interested in selling for 1/1, it's absolutely still possible, but the training does take some time to be a premier agent with zizzl Health. It'll typically be just a couple of sessions with our team, but we'll get you up and running on our software system in, if you're motivated, a couple of weeks here and get you off into the races. Though it's something that, as we look towards OEP, does require that you get your footing. We don't necessarily want folks, coming in at the last minute looking to sell ICHRA. We'd love for you to learn the process today, to add it to your book today, and then if you have an opportunity come to your door, you'll be ready to go. So it can be just a few weeks, but the closer you push it towards open enrollment, the more challenging it gets. You definitely don't want to be selling scared.
I will just add to that too. ICHRA for an employer, employers are not always renewing on 1/1, right? So their renewals can be 2/1, 3/1, 4/1. So even if you're not ready or you want to focus on 1/1, saying not to say that that's what you should do, but as an alternative, ICHRA sales will happen all year round on different effective dates throughout the year.
Yeah, I mean, that's a great point. We sold more for 7/1 this year than we did for 1/1 2 years ago. So as we kind of grow and really move in the market, we're seeing that businesses don't all renew 1/1, and businesses who renew 1/1 sometimes want to get out a little bit quicker. So we know the ACA has planned start dates every first of the month, and the ICHRA is a QLE that allows a business to jump in with ACA coverage mid-year. So a lot of folks are getting out, to Sean's point. If this isn't something that you do for 1/1, there's no reason that you shouldn't be selling it for 2/1.
Another good question here. Thank you for all the questions, by the way. What is the max employer size, and can you add supplemental products?
You can add supplemental products. They work fantastic, just like they would work with ACA coverage today. You get a high deductible plan, accident, critical illness product to kind of come in and buy down the deductible is a great option, and it works very well in the ICHRA space. There is no maximum size employer group. So you will see employer groups in the 1,000 plus enrolled with an ICHRA. You will also see employer groups with 2 employees with an ICHRA.
All right. Are the dollars provided via the ICHRA from the employer only used for insurance premiums?
No, that's another good question. This is another area where the ICHRA can provide an advantage over traditional group health. If your employer puts enough money in your HRA that you can pay for 100% of an ACA plan premium, you can use the leftover dollars for expenses. So they'll fall into the 213D expense bucket. Let's say my company's giving me $500 a month, and my local silver plan from the carrier I pick costs $400. That means I have $100 every month still sitting in my ICHRA that I can now use on my healthcare expenses. So maybe my glasses or my contact lenses, maybe a copay at the doctor. And this is extremely powerful. In this healthcare model, you have employees who not only have 100% of the premium funded, they're also getting dollars from their ICHRA to use on their expenses. So it's really a way to make sure people aren't overinsured, aren't underinsured, and are using their employer's contribution in a way that makes the most sense to them, which again is just something you don't get in traditional group health, that expense bucket.
I don't think I'll be able to get a chance to get to all these questions, but I am trying to vet them live and bucket them. So in terms of renewals, can you speak a little bit about the renewal process and how the employer premiums will change?
Yeah, so as we all know here, the renewal process with an individual member is fairly streamlined in the ACA market. You're not looking like a traditional group at their utilization. And so we do see more price stabilization in the individual market. Average premiums across the country are typically, state by state, going up by single digits. Now, there are some states like New York that don't always make us super happy with their individual premium increases. But on the group side, we're seeing it track to at least 1% to 2% higher on those average increases for the small and mid-sized group markets. So year over year, employers get to work with zizzl to decide how much more goes into their bucket. And it's a simple process. We show them where the ACA market is going. They decide how much to re-up in their budget. They don't have to worry if they had a sick employee this year that means they need to put 40% more in.
Yeah, and just to add to that, and I had referenced it, and I just want to restate it. In 2024, the average employer increase for small and mid-sized businesses is 9%, and that is the highest that it's been in more than a decade. So I think that is one of the biggest drivers now of people really looking at ICHRA, because those expenses year over year just need an alternative, and this is a great one.
It's rare in the traditional group space that you have carriers reduce their rates in a given year. You usually don't see that in your renewal packet, but that actually happens in individual, and it shocks our ICHRA clients.
How do Medicare-eligible employees use ICHRA?
So ICHRA is really unique. As most of you probably know, in a traditional group health plan, you can't force your Medicare age employees onto Medicare. It's not allowable. It's considered discrimination. You can't do it. With an ICHRA, it's exactly what you're doing. There is no other option for them. As you also know, ACA coverage is not typically available for Medicare-eligible individuals. So their option when their employer moves to an ICHRA is to use those dollars to pay for Medicare. which they can do. Medicare is also ICHRA eligible coverage. So those 65 plus employees on the traditional group health plan are moving from that plan to Medicare. Everybody 65 or 64 and under is moving to an ACA plan, and they're all getting a great benefit without the employer having to pick a one-size-fits-all insurance arrangement for everybody. So if you sell ACA and you sell Medicare, I'm sure you can see the writing on the wall. You are a great fit as an ICHRA consultant. There aren't a lot of brokers out there who can talk an employer group through their Medicare employees' needs, through their ACA employees' needs, and then talk them through the other ancillary coverages they might add as well. So if you have that skill set, I mean, it's huge for ICHRA.
Yes, huge opportunity to expand your business for sure. So we talked about the maximum number of employees. What's the minimum?
There is no minimum. So the pricing will obviously be competitive for groups where their group health plan premiums are raising year over year, but you'll see virgin insurance companies not even quote ICHRA against anything else because it's so simple. We've got 2 life groups where a company just started in our city and they heard of ICHRA, they love the simplicity, they love the technology behind it, so they jump right in. We also have 2,000 life groups that go through an arduous RFP process to make sure the network's aligned, to make sure the pricing is scaled exactly to their budget and their expectations. There really isn't a one-size-fits-all, segment for ICHRA. I think you'll find groups of every size that really love it.
Question on minimum contribution from the employer. I can't find it here now.
Yeah, so if you're an ALE or an applicable large employer, you are going to have what we call the minimum affordable contribution requirement. So that will be essentially a number derived from each employee's lowest cost silver plan as well as their income that's designed essentially to make sure the employer is putting enough money in that ICHRA bucket so that the employee is not spending an inordinate amount on healthcare or an unaffordable amount. So for next year, I believe we actually changed the percentage of employee income to 9.02%. But essentially, if an employee buys their lowest cost silver plan on the exchange where they live, their employer contribution is supposed to fund enough such that they wouldn't spend more than 9.02% of their income buying that lowest cost silver plan. So it's a fairly complex equation, but we have calculator tools that do it for every business so you don't have to worry about it, that will show them what their threshold is to meet that minimum contribution. Now that's for groups with 50 plus. If you don't have 50 plus, there is no minimum contribution requirement. You can put whatever you want in that bucket. You just have to be considerate of your employees' ACA needs. So if you throw $10 in the ICHRA bucket every month, you do want your employees to know that they should still go to the exchange and see about a premium tax credit.
It's a great, so related is you might have just answered this too, ICHRA and APCT tax credits, right? So that, I think we can, I'll go to another question, sorry. I think you just answered that as
Sure.
I was looking through them. I think we can probably do 1 or 2 more questions. I don't think we'll get to everybody's, but apologies. Again, just to promote the booth, stop by and say hi to Brett at Zizzl. The Oscar team was also downstairs as well, so if there's any questions on the carrier lens that I can provide further guidance on it, be more than happy to. What type of insurance companies and plans are available through ICHRA?
Yeah, it's the ACA plans. Should make a lot of sense to you. It's going to be the same carriers you'd see on healthcare.gov. It's going to be typically the off-exchange versions of their plans, but it'll be the exact same carriers, same reps, same processes that you know and love today, but it's totally new for a traditional group broker. So again, just put yourself in their shoes. Their client tells them that they want to quote an ICHRA, and they don't even know who the ACA carriers are where that client's site is. So you have a big advantage here to come in and disrupt.
All right. I think with that, we'll wrap up the Q&A. Gloria, are there any
No, we're good.
comments?
Perfect.
Towards
Thank you so much.
Well, thank you very
Mike
much.
and Sean.